Gallstones, also known as cholelithiasis, are hardened deposits that form in the gallbladder, a small, pear-shaped organ located under the liver on the right side of the abdomen. The gallbladder stores and concentrates bile, a digestive fluid produced by the liver that helps break down fats. Gallstones can vary in size from tiny grains to large stones and may form when the chemical balance of bile is disrupted. Types of gallstones. There are primarily two types of gallstones. Cholesterol gallstones, these are the most common type, accounting for about 75 to 80% of cases. They form when there is too much cholesterol in the bile or when the gallbladder does not empty properly. Cholesterol stones are usually yellow-green in color. Pigment gallstones, these are smaller and darker, made of excess bilirubin. They are more common in individuals with certain medical conditions like liver disease, infected bile ducts, or sickle cell anemia. Causes and risk factors. Gallstones form when bile contains too much cholesterol. The liver may secrete more cholesterol than bile can dissolve, leading to crystallization and stone formation. Bile contains too much bilirubin. This can occur in conditions like liver disease or hemolytic anemia, contributing to pigment stone formation. Gallbladder does not empty efficiently. Incomplete or infrequent emptying can allow bile to become overly concentrated, facilitating stone formation. Several risk factors increase the likelihood of developing gallstones. Gender: women are more likely than men due to the effects of estrogen, which increases cholesterol levels in bile. Age: the risk rises with age, especially after 40. Obesity: excess body weight increases cholesterol levels in bile. Diet: high fat, high cholesterol, and low fiber diets can contribute. Rapid weight loss: losing weight too quickly can disturb the bile composition. Family history: a genetic predisposition may exist. Pregnancy: hormonal changes during pregnancy affect bile composition. Certain medical conditions, diabetes, cirrhosis, and sickle cell disease raise risk. Symptoms: many people with gallstones remain asymptomatic for years and may not require treatment. However, when a gallstone blocks the bile ducts, it can cause a gallbladder attack or biliary colic, characterized by sudden and intensifying pain in the upper right abdomen or center of the abdomen, pain that radiates to the back or right shoulder, nausea and vomiting, bloating, indigestion, or gas. Pain may last several minutes to a few hours, often occurring after a fatty meal. Complications: if untreated, gallstones can lead to serious complications such as cholecystitis, inflammation of the gallbladder, causing severe pain, fever, and infection. Cholelithiasis, when gallstones migrate into the bile ducts, causing obstruction and infection. Pancreatitis, if a gallstone blocks the pancreatic duct, it can inflame the pancreas. Gallbladder cancer, although rare, chronic gallstone irritation can increase cancer risk. Diagnosis. Diagnosis typically involves ultrasound, the most common imaging technique for detecting gallstones. CT scan or MRI, used to assess complications or stones in the bile ducts. HITA scan, assesses gallbladder function. Blood tests, help detect infection, jaundice, or pancreatitis. Treatment options. Treatment depends on the severity and symptoms. No treatment, watchful waiting for asymptomatic gallstones. No immediate treatment is necessary. Medications, oral bile acid pills like ursodeoxycholic acid can dissolve cholesterol gallstones, but treatment takes months or years and recurrence is common. Surgery, cholecystectomy the most effective and common treatment. Removal of the gallbladder is usually done via laparoscopic surgery. Patients can live normally without a gallbladder, as bile flows directly from the liver into the intestine. Endoscopic procedures, ERCP. If stones block the bile duct, an endoscope can be used to locate and remove them. Prevention. While not all gallstones can be prevented, some lifestyle changes can reduce risk. Maintain a healthy weight and avoid rapid weight loss. Follow a balanced diet rich in fiber and low in saturated fats. Exercise regularly to regulate bile cholesterol levels. Conclusion: Gallstones are a common yet potentially serious condition involving the digestive system. While many individuals remain asymptomatic, complications can be painful and require medical intervention. Early diagnosis and appropriate treatment ranging from dietary changes to surgery can help manage the condition effectively and prevent severe outcomes. With proper medical care and lifestyle adjustments, most individuals with gallstones lead healthy, symptom-free lives.
Thank you for watching. Please subscribe our channel.